Okay, I'm Alyssa Gibson, and I am from Minnesota State University in Mankato, and I'm from Minnesota.
I'm Abby Deeth. I'm also from Minnesota State University, Mankato, located in Minnesota.
I'm Tycho. I'm 80 years old. I'm in my second year of my nursing degree and on Windesheim in Zwolle.
I'm Debbie Harting. I'm 80 years old. I'm also in my second degree of in my second year of nursing degree, and I'm from the Netherlands. Um, so our case study is about my best friend and her family. She's 90 years old and lived with her parents and her little brother. He's 15 years old in Apeldoorn. About a year ago, there was a lot of fighting between her parents. After a little while after that, she found out her mother was cheating on her father. It was a very difficult time for her and her brother. My friend received a lot of support from her friends and her boyfriend, but her brother had no one he could really talk to. My friend and her brother have a good relationship, but in this time, my friend spent a lot of time at her boyfriend's place. Their mother left their home and moved in with a new boyfriend. Um, my friend's brother had a very hard time and spent a lot of time with his so-called friends. These friends drink a lot and sometimes they do drugs. They had a very bad influence on him. Her brother was more and more often away from home because he didn't want to be with his parents, who were always fighting. He drank, blowed, and sometimes he even stole. When he got home in the middle of the night, he was very drunk. He yelled to his parents and was very rude. His parents decided he could talk to a psychiatrist, but he refused. At one time, he even drank so much he ended up in the hospital. This eventually turned out to be a suicide attempt. After this incident, he cried for weeks. He saw what he was doing and that something had to change. He went 3 times a week to the psychiatrist and slowly became happier. So, our subject is alcoholism, and um, we're gonna discuss the difference between the Netherlands and the US.
Okay, so in the US, our definitions we found were pretty much the same. So it's just a serious problem of drinking, and it's a strong, often uncontrollable desire to drink. And they usually put it above every other obligation. So they would pick to drink over their family or their work activities. And a lot of times they'll have withdrawal symptoms if they're used to drinking all the time. And then one difference we found between here and the Netherlands is that the legal drinking age in the US is 21 years old, and the drink of choice in the US is vodka, because I read that it was cheap and fairly odorless compared to other alcohol beverages.
The definition in the Netherlands is that you're an alcohol addict when your body is physical and mental dependent of alcohol. Physical dependency is when you stop and get withdrawal symptoms, and mental dependency is that it affects your mood. The legal drinking age in the Netherlands is 18 years old. A few years ago, it was 16 years, so that's the difference between here and the US. And the drink of choice is beer because it's cheap. And in the graph in the right corner, you can see that the yellow line is beer.
Okay. The prevalence in the US, so there was just some studies that I found, but 18-year-olds and plus, there's 15.1 million people that drink alcohol. And youth 12 to 18 years old, there's 623,000 adolescents. So you can see that even though it's not legal, it's still a large prevalence within the US to drink alcohol. And about 50% of people start at 18 and become regular alcohol drinkers. So that's a pretty big statistic considering that in the US it's not legal until 21. 23% of adults aged 18 and above drink more than 5 alcoholic drinks in one day. So that would be considered an alcoholic if you drink 5 or more in one day. And then almost 60% of men are current regular drinkers. So we found that more men are alcoholics than women in the US. And then 86.4% of people ages 18 or older reported they drank alcohol at some point in their life. So a majority of people have at least drank some type of alcohol in their life. 70.1% reported they drank in the past year. 56% reported that they drank in the past month.
Prevalence in the Netherlands. People talk about alcohol abuse when men drinks 21 glasses of alcohol in a week and 14 glasses of alcohol for women. In 2017, 1.6 million adults drink too much. That's 9.2%. In America, is that 11.7%. So in America, is the problem bigger? 9.2% of the other adults drink too much. 11.5% of the men drink too much, and 7% of the women. So that's not a difference from America, because here in the Netherlands, the men drink, there are more men that are heavy drinkers than women. Between the age of 12 and 17, 10.7% are heavy drinkers, and 477,000 alcoholics. There are 477,000 alcoholics in the Netherlands. That's 2.8% of the population in the Netherlands and 4.6% of America.
Yeah, and I think another difference between the Netherlands and the US is it says between 12 and 17, 10.7% are heavy drinkers. Here, I wouldn't say that the percentage of 10.7 would be that prevalent, because our legal drinking age is until 21. So 12 and 17 would be really young here to start drinking and to be a heavy drinker.
Yeah.
Mm-hmm.
Yeah, okay.
So in the US, a cause of alcoholism, we found these causes pretty similar. So a family that has a history, people drink to help improve their mood and spirits, to help forget their problems. They might be depressed if they're drinking, or drinking can cause depression. Peer influences are a huge contributor, and undereducated adolescents that don't know the consequences of drinking.
Yeah. The causes of alcoholism in the Netherlands, there are three factors. Physical factor is habituation. Social factor is peer pressure, house rules, and easy to obtain. Psychological factors are depression, stress, and trauma, or problems at home. And in the Netherlands, lower educated people drink more, and that's the same as in America.
Yep. Okay, so society's reaction to alcoholism, we found similarities in stigma within the US and Netherlands. So stigma is labels such as dangerous, immoral, or blameworthy. So a lot of these words and labeling makes alcoholics not want to get help because they're seen as a bad person pretty much. And stigma is higher for men, previously married individuals, people of lower income or education. So people are more likely to be judged if they have those criteria. Women receive more empathy if they're an alcoholic, so people don't feel as bad for the men. The reaction for family members that have an alcoholic in the family is they might drift, they'll worry about them, and they're also impacted by this disease. Personal coping methods are used and determine if users talk about their situation. So in the US, it really depends on the person and how much support they have, whether they're willing to talk about it or express their feelings about it and get help.
Society's reaction to alcoholism in the Netherlands. We also have stigmas in the Netherlands. 19 till 49% of the population thinks that alcohol is a mental illness. 45 till 60% of the population blames the alcoholism to the addict. When stigma is high, we couldn't find so much information about that, but addictions, stigma is high for addictions than for other mental disorders like depression or something else. And family members are hiding the problem for other people in their environment because they are shame. or they are isolated because they don't want to talk about it, and children with addicted parents can get problems.
So within the US, we have AA meetings, which is just an Alcohol Anonymous meeting that people can attend, or SAMHSA is a helpline that anyone can call, and it's free and confidential, and it's open all the time, so people with the problem can call this number, or also people with a family member. And then in the US, I found that family members or friends can help their loved ones or support their alcoholic in the family, and they can learn about alcoholism. They can offer support for the positive changes, such as trying to stop drinking. They need to express their love, and that they need to know that recovery is ongoing. They're not going to just quit within a day. It takes an ongoing process. They could offer to attend therapy with the individual because it would help them feel supported and cared about. And then another thing that Tico will talk about is the Minnesota plan. And in the US, I tried to look that up, and I didn't see anything about a Minnesota plan. So I think it's something that the Netherlands uses more than we do here, or specifies it as this plan.
Yeah, it's it has been made out of the AA meetings in the Netherlands. It's a kind of AA meeting and self-help groups. So.
Okay. The support systems in the Netherlands. The support for the patients, we're going to talk about in the next slide. But for the support for the family of the patient, there are relatives groups. Family can talk about and support each other, get information about how you can deal with certain situations. There are different sites on the internet. You can find their information and tips. And in some clinics, there is a family trust person. She can mediate between the family and the care providers if there are issues concerning the treatment.
Then there's different types of treatment for alcoholism. They're kind of individualized for each patient, what they want to go to, what extent they want to go to, family being involved or not. And a lot of patients might struggle to move forward and kind of go backwards in the different stages of treatment. And then there's 3 types: alcohol detoxification, inpatient rehab, and then alcohol counseling or outpatient rehab. So alcohol detoxification, that's when you medically manage the detoxification process using medications. In the hospital, they use Valium a lot, or other benzodiazepines. Sometimes they use other comfort meds for pain, that they just monitor the withdrawal symptoms such as anxiety, nausea, abdominal pain, hallucinations, seizures. These usually take place in a hospital or an inpatient center where there's a medical team to provide supervision and support around the clock. And then inpatient rehab, this happens after the detox process. This is used to prevent relapse for alcoholics, and then they also help accommodate the physical addiction needs as well as the psychological addiction needs of the patient. And it also helps with mental illness that may be related to alcoholism. They also work to develop life skills outside of addiction that might help them move forward with getting a job and keeping their family close, and then keeping their life on the right track. And then alcohol counseling is an outpatient rehab type of setting. The counselors offer guidance support during treatment and recovery phase. It's kind of similar to going to therapy and just talking about the issues and the progress they're making. They work with both the patients, families, and other loved ones during this transition, and they help the patient develop a treatment guide based on that patient's goals. And then they also work with other support groups like Alcoholics Anonymous, or Al-Anon, which is Alcoholics Anonymous, but for family members to attend if they have a family member who is an alcoholic or a recovering alcoholic.
So now we're moving into the treatment in the Netherlands. Before it was in the US.
Yes. Now in the Netherlands, you have behavioral therapy to change someone's behavior. The 12 Steps program, also called the Minnesota model, that's just made out of the AA groups, and alcohol detoxification in patient rehabs. We have self-help groups in AA meetings and motivational talks. Nurses and other health professionals learn that, and everyone can do it. And we think that counseling in America means motivational talks in America, in the Netherlands.
So alcohol consumption is prevalent amongst all ages, from usually about age 12 to 18 for anyone underage, and then above 21, most people drink until their late ages. So alcoholism results in 88,000 deaths annually, and it's the third leading preventable cause of death. And these deaths can either be chronic disease, accidents, any type of death resulting from alcohol consumption. And then alcohol damages the body from the start to the beginning, from consumption to excretion. And so it leads to a lot of injuries from the mental deficits from drinking alcohol. You know, there's car accidents, physical accidents, suicide, sometimes homicide, but there's also heart disease, hypertension, liver failure, pancreatitis, cancers of the mouth and the digestive system, and neurological issues, a lot of dementia-related issues from alcohol consumption. The leading medical issue is liver cirrhosis that affects 633,100,000 annually. And then preventable injuries such as car accidents or any injuries that might be related from drinking alcohol, 500,000 annually are affected by that.
Medical issues in the Netherlands. There are a lot of different diseases because of alcoholism. The most common alcohol diseases are Korsakoff, cirrhosis of the liver, and cancer. About 9,000 people has Korsakoff. 1 of the 10 heavy drinkers gets liver cirrhosis, and 3% of the cancer mortality and 2% of the cancer incidence is because of alcohol. Annually, 3,000 new cases of cancer due to alcohol use.
So in the Netherlands, people pay an amount of money that goes to the government, and the amount of money you get back depends on the earnings you get. Everyone in the Netherlands is obligated to be insured, and everyone has his own risk of 385 euro. The cost for healthcare above this amount covers the insurance.
In America, Americans aren't obligated to have insurance. They're not provided by the state. So either they're self-insured or their employer will help them be insured. And unfortunately, some of the people who struggle with addiction or alcoholism have lost their jobs or aren't able to afford health insurance. So a lot of times they have to pay for treatments out of pocket, or their family pays for them, or the state ends up paying the difference of the cost of their health care. So it can be financially a burden for a lot of people.
Mortality of alcoholism in the Netherlands. Alcohol mortality is a sum of primary and secondary alcohol deaths. The primary means the deadly overdose, and the secondary is deadly accidents under the influence of alcohol. In total, there are 1,722 cases per year, and alcohol death is the most common in the 55 and 69 age group, and the most common by men.
For the United States, a lot of chronic diseases are related to alcohol, but it's very hard to pinpoint exactly what causes it. So the most common cause of deaths related to alcoholism. 40% of deaths are related to alcohol consumption, and these include accidents, suicides, murders, any other injuries that cause death. But then chronic disease can be related to alcoholism, even though cirrhosis is the most common. Other cancers and other heart disease and kidney disease, all those can be related back to alcoholism as well. Cirrhosis is the most common, and it affects 15,000 people annually are diagnosed with cirrhosis. And then alcoholics are 5 times more likely to develop chronic conditions over time than non-alcoholics. So alcoholism.
Sorry.
Alcoholism is a global issue. Sorry.
You're good. That was what I was saying.
There were differences in the alcoholism between the Netherlands and the United States, from how it's viewed, the stigma behind it, the different treatment options. We have a lot of treatment options, hopefully, to help each patient individually, however they feel that they need to be fit. And then also the ages, due to the ages drinking is legalized between the Netherlands and the United States, and the ages that people start drinking and the higher prevalences of drinking. There's also common conditions, though, and common statistics that men drink more and women drink less, and chronic conditions such as liver cirrhosis and also accidents and the mortality of alcoholism. And then just as nurses, we learned that we can always offer these resources and education and preventative treatment to our patients, and also just give unbiased care, because there is such a stigma behind it and it is such a issue. And then there was some differences. The legal drinking age is different. In the Netherlands, it's 18. It used to be 16, and now for us, it's 21. So there's a 3-year difference. Drink of choice was different. Netherlands, they drank beer more, and we drank vodka more. There was more of a problem in America due to the population size. The percentage size was higher in America than in the Netherlands. They just have a different models of treatment. They use the Minnesota model, where we used detox and inpatient programs more. And then there's just more motivational toxin counseling available, differing motivational toxin counseling available between the two. And then the healthcare system is a very big difference that affects a lot of patients' treatment in both countries.